Welcome. My name is Dominic Gilroy. I'm a Library and Knowledge Service Development Manager working in the North. And this is an introduction to Outcome 1 of the Quality and Improvement Outcomes Framework. It's one of a series of support webinars for library and knowledge specialists. Another webinar is available which provides a general introduction to the Outcomes Framework, and we would recommend that you watch that introduction before viewing these more focused guides. The main objective of today's webinar is to discuss the purpose of Outcome 1 and to develop an understanding of the levels in relation to it. This presentation will therefore provide an overview of what the outcome is about and why it is important. We'll look at why the outcome is important to stakeholders and to library and knowledge specialists. We'll look at the levels in relation to the outcome. And we'll ask some questions in relation to the outcome, which you may want to ask in relation to your own service. And then we'll look at some of the learning from the pilots. We do want to use this session to share some of the learning from the pilots that took place last year. And therefore, in addition to the actual webinar here, we'd recommend that you listen to the recording from Donald Mckay. Donald is from the Bodleian Library in Oxford and took part in the pilot in 2018. An audio file shares his experience of the process. Outcome 1 states, all NHS organisations enable their workforce to freely access proactive library and knowledge services that meet organisational priorities within the framework of knowledge for healthcare. The outcome is particularly specific to organisations. It's about the engagement of the organisation and confirming they recognise the business critical role of library and knowledge specialists. It will demonstrate the extent to which the organisation is committed to providing appropriate resourcing to enable the workforce to access the library and knowledge services they need. And it looks at how well the organisation resources the library and knowledge service, particularly to ensure it's sufficiently resourced to meet organisational and national priorities. The outcome looks at how library and knowledge specialists develop proactive services to meet those organisational and national priorities within the changing environment in which they work. There's an emphasis on library and knowledge specialists working with organisational stakeholders and developing strategic plans to demonstrate that the library and knowledge services outcomes and achievements are meeting the priorities of the organisation. This is achieved through evaluation and engagement. Outcome 1 puts the Chief Executive and the organisation's knowledge and evidence culture squarely in the frame. It asks the organisation to think critically about the way that stakeholders engage with library services, whether these are delivered in-house or by another provider under a service level agreement. In developing the initial pilot quality improvement standards and the resulting outcomes framework, we asked the following questions. How will the outcome help in decision-making for organisations? And how will the outcome help in decision-making and service improvement for library and knowledge services? We'll provide you with some of our thoughts in answering these questions in the context of this outcome. There may be other answers to some of the questions, and some of these will be specific to your organisation. You may want to consider those too. So here are our thoughts about answering the first question, how will this outcome help in decision making for the organisation? First, we thought the outcome would ensure that best evidence is available and used to inform service design within the organisation. Secondly, we believe the outcome will help the organisation to evaluate the level to which it is using the abilities of library and knowledge specialists in ensuring that the decisions made are evidence-based. And thirdly, The outcome provides assurance for organisations that library and knowledge specialists are adapting their services to organisational priorities and responding to ever-changing evidence needs. Moving on to think about how this outcome might help in decision making and service improvement for library and knowledge specialists. Firstly, we hope that this will help you to think critically about the reach of engagement within your organisation and the organisations which you serve. Secondly, we feel that by identifying good practice and gaps, you'll be able to influence for enhanced engagement in the areas identified and suggest services and resources which may need to be refocused. Moving on now to look at the various levels in relation to this outcome. As with all outcomes in the framework, progression from level 0 to level 4 takes us through an increasingly mature model of service delivery. An organisation working at level 0 is one in which either access to library and knowledge services and specialists has not yet been developed, or it may just be that the organisation and service is not performing in this particular outcome. At level 1, there will be standard service management tools in place, and these will include a strategy, an implementation plan, and a budget. There will be evidence of engaging with stakeholders to develop and refresh these tools. There will be evidence of monitoring and reporting progress on the implementation plan. There will be evidence for engagement with the board and evidence of managing the budget. The key aim of the Quality and Improvement Outcomes Framework is service improvement, and as such there will be an expectation that all services have a service improvement plan in place, resulting from this baseline self-assessment. For services operating at level 0 and at level 1 in one or more of the outcomes, organisations should expect a more intensive monitoring of the service plans and to work closely with HEE's Library and Knowledge Service leads in this regard. As we move to level 2, the ad hoc engagement and monitoring of the management tools seen in level 1 has moved now to a more systematic approach. We will be asking questions around: are we routinely seeking input into our planning processes? Are we systematically gathering feedback and evaluation and outcomes relating to our activities? And can we show that we've changed or developed services as a result of our users' input? Some of these features may be familiar from LQAF. At level 3, the service becomes more deeply embedded within the workings of the organisation. There are ongoing discussions with senior stakeholders in the organisation about the strategy and implementation plan. The case can be made for additional resources and cases made to implement new and improved services because the organisation sees how critical library and knowledge specialists are to their operations. We are also able to show that so what relating to our services and the impact of what we do is recognised in the organisation. At level 4, Our service is fully integrated into the organisation, and champions from board to ward are actively promoting our expertise as business critical. This also means that we are in the meetings where planning is happening, because people in the organisation know that they're going to need evidence and knowledge from us to inform their decision making. And we know our stakeholders and the organisation's needs, so we can be proactive at spotting opportunities to deliver the right knowledge and evidence at the right time. We'll move now to consider some of the questions which might be useful for us to consider when thinking about this outcome in relation to our service. As you can see, many of these themes are of particular relevance to library and knowledge staff in considering an approach to this outcome. For example, as this outcome has an organisational as well as a library and knowledge service focus, the library stakeholders are a vital consideration. We will need to consider who they are, how we consult with them, and how much they are involved in the planning and review of our services. To what extent is this outcome a strategic imperative for this library and knowledge service? How do we identify our organisation's priorities? What strategies are used to promote the vision of our library and knowledge service? What implementation or action plans are in place? What you call these plans is less important. It's about having a plan written down that you can follow. How are your stakeholders involved in service delivery? Who are our library and knowledge service stakeholders? And how do we consult with these stakeholders? How effective have we been in meeting the priorities of the organisation, and how do we know? How effective have we been in meeting the priorities of knowledge for healthcare? Remember, at the moment, these are managing evidence and organisational knowledge and health information for patients, carers and the public. How good is the library and knowledge service at adapting to change? How are we encouraged to introduce new services or improve our existing ones? How do we plan and manage any new developments? And what new services or innovative projects have we already recently introduced? Moving on now to think about some of the good practice identified in the pilot. The pilot took place in 2018, and although the standards did vary slightly from the current outcomes and the self-assessment scale was different, the principles were similar enough that the learning can be transferred to our new outcomes process. So thinking about the feedback provided by Health Education England's Library Services team to the services that we verified as performing at higher levels within the standards, the positive feedback is given in the bullet points shown. Although a direct comparison is not possible, in the new outcomes, this service might be associated with around a level 3. We identified consultation on the strategy. The whole Library and Knowledge Services team was aware of the strategy. Progress was measured against the implementation plans using a dashboard approach. The plans had sign-off from the board. There was clear input from and reporting to the other organisations served by the library. And there was clear alignment with organisational and knowledge for healthcare priorities. With all the sites in the pilot, we did provide areas of guidance. Key themes included in our feedback were the need to demonstrate alignment to knowledge for healthcare as well as organisational priorities. And again, just to repeat that, at the moment these are around managing organisational evidence and knowledge and health information for patients, carers and the public. We suggested that there would be better evidence of consultation with stakeholders. And relating to this, we asked for greater clarity about how Library and Knowledge Services priorities were aligned to organisational needs. We also encouraged more evaluation and reflection on the performance of the service, both in terms of successes and also lessons learned. Please do listen to the reflections from Donald Mckay. As we mentioned, Donald took part in the 2018 pilot, and he shares some valuable thoughts and reflections on his experiences, which you might find helpful. You'll find Donald's audio file on the Knowledge for Healthcare blog page with the other supporting documents. So this concludes the presentation for Outcome 1. Many thanks for listening. If you do have any questions relating to this outcome, or indeed any aspect of the Library and Knowledge Services Quality and Improvement Outcomes Framework, please do get in touch with your regional contact, whose details can be found on this slide.